My name is Maja and I'll be your student nurse today. Could you please verify your name and date of birth?
Ryan Torrance, 5/5/1997.
Just putting on some hand sanitizer. General survey. The patient's posture looks good. He's dressed appropriately for the weather. He looks clean. And it looks like he's in good spirits today, right? Are you having any pain today?
No.
Could you rate that on a scale of 0 to 10?
0.
Alright, since the patient said he was experiencing 0 pain, that means old carts would not be applicable. Do you have any past surgeries that I should know about?
Umbilical surgery in my wisdom teeth.
Like an umbilical hernia surgery?
Mm.
And are you currently on any medications?
No.
And are you allergic to anything?
No.
Okay, moving on to the mental status. So you already told me who you were. Could you tell me where you're at?
Your room.
And what's the date?
April 9th.
And why are you here?
Headed to assessment.
Okay. Could you tell me what the last holiday that we just had?
St. Patrick's Day.
And who is the president of the United States?
Donald Trump.
Okay. The patient is alert and oriented times 4, person, place, time, and situation. His long-term and short-term memory is also intact. Next, we're going to be doing, we're going to be testing cranial nerves 1 and 11 today. So 1 would be your olfactory, and I'm going to ask you to close your eyes and tell me what you smell.
Peppermint.
Okay. And for cranial nerve 11, could you just move your arms, shoulders up and down and against resistance? Alrighty. So cranial nerves 1 and 11, which is the olfactory and the accessory cranial nerve, are both intact. Moving on to the eyes and ears. First, we'll do the ears. By the looks of it, the ears are the same color of the rest of the face. There doesn't seem to be any piercings or any drainage or any sign of infection. We're going to be doing the whisper test. So I'm just going to give you 2 words, 1 in each ear, and you just tell me what I said, okay?
Yellow. Dog.
Okay. The patient just displayed that he can hear in both ears without any complications. Moving on to eyes. Just by the looks of it, there doesn't seem to be any discharge coming from the eyes. The conjunctiva is pink and moist. The sclera is white. We're going to first be grading his pupil size. And the patient's left side, pupils are about a 4. And the patient's right side are also about 4 millimeters in diameter. So I'm going to have you look at my pen and just follow it without moving your head, okay? Okay, if you could look at my top of my pen and then look at that back wall and then back to my pen and back to the wall. Okay, you'll be coming in bilateral or from the lateral side. The pupils are equal round and equal to light and accommodation. Next, we're going to be doing head and neck. Sorry. For at first sight, the patient's face looks symmetrical. At this point, I would lower the bed to 45 degrees, and I would ask the patient to move his neck, not to the other side. And there doesn't seem to be any jugular distension. Next, we're going to be doing the mouth. The patient's mouth and lips are intact, don't seem chapped. I'll have you open your mouth. The tongue is pink and moist. A little bit of white exudate on both the tongue and back of the throat. Teeth are intact. It does seem like he has all adult teeth. Gums are pink and moist. And if you could stick your tongue out and say, ah, the soft palate rises with phonation. And if you could stick your tongue out, move it around, and the tongue can move freely. Next, we're going to be assessing the skin, and the skin is appropriate for his ethnicity. I'm going to be testing for skin turgor on both the upper and the lower extremities. And it doesn't seem like that there are any dehydration, no signs of tenting. There also doesn't seem to be any lesions or bruising of any sort. The temperature of his skin is warm but afebrile, and his skin is smooth without any scratches. Moving on to cardiac, I'm going to be, first, I'm going to be locating all of the heart valves. On the right side, second intercostal space, sternum border, we have the aortic valve. On the left side, second intercostal space, sternum border, we have the pulmonic valve. And then left side, fifth intercostal space, sternum border, we have the tricuspid. And then fifth intercostal space, mid-clavicular, we have the mitral. Okay, I'm going to be checking for capillary refills on both the upper and the lower. And all four refilled within 5 seconds. Next, I'm going to be taking your apical heart rate. I'm going to be doing this for a full minute. I'm going to be also placing the bell of the stethoscope on the apex. And start. And stop. The patient's heart rate was 72, which is within the normal ranges of 60 to 100. Next, we're going to be doing blood pressure. Do you prefer an arm?
Does do that.
Okay, could you stick one of your arms out of your shirt, please? Okay, I'm going to be placing a cuff, which is the appropriate size cuff, on his right arm, 1 inch above the antecubital space. Now I'm going to be trying to find the estimated systolic. So you just relax your arm. I lost it at 120, so I'm going to bump it up to 150. I got 128/88, which is within the normal ranges, systolically being 100 to 139, and diastolically 60 to 90. Next, we're going to be checking for edemas on both the upper and the lower. I'm going to grade the uppers as 0, then the lower, also 0, no sign of edema. Now we're going, also his heart rate was deep, even. And now we're going to be doing respiratory. So I'm just going to be counting your breaths. Just breathe like normal, okay? And start. And stop. I got 14 breaths per minute, which is within the normal range of 12 to 20. Next, I'm going to be listening to your lung sounds. Mind if I breathe for me? And again. And one more time. Okay. I'm going to do one on the lateral side. Okay. And a couple on the back. Deep breath. And again. And again. And one more time. Okay. The patient's breathing was unlabored. It was deep and even, and there were no signs of crackles or fluid in the lungs. Now we're going to be doing gastrointestinal. So, lay on back. There you go. In a real setting, he'd be actually laying down, but I'm going. Mind if I lift this up? Okay. So keeping the patient comfortable. I'm going to look before I listen and look before I touch so I don't disrupt the bowel sounds. So I do see the scar where he had stated that he had an umbilical hernia surgery. Other than that, I don't see any other lesions, and his abdominal area looks symmetrical. Now, I'm going to be listening in each quadrant for bowel movements. And I heard a bowel sound in every quadrant. Now I'm going to palpate in all 4 quadrants. You just let me know if you have anything, okay? Okay. I don't feel any abnormal lumps. I don't feel any bladder distension. Do you have any nausea or vomiting? Mm-hmm. Any chest pain? Do you have trouble using the restroom?
No.
And when was the last time you had a bowel movement?
No, 2 hours ago.
Okay. And how would you describe your urine?
A little dehydrated, so it's probably a little yellow, but doesn't smell.
No foul smell. Okay. Next, we're going to be doing the musculoskeletal, I guess is the last one. So now I'm gonna have you pull my fingers, or grip my fingers, not pull my fingers, grip my fingers, and pull towards you, and push me away, okay? And if you could get up and walk, move all those extremities. The gait is smooth, and the patient can move all 4 of his extremities. We're going to test for the Romberg for his balance. So if you can stand there, close your eyes. Okay. The patient didn't even sway, so he tested negative for the Romberg, which is good. Next, I'm going to have you take a seat again. And we're going to test your patellar reflex. Find a little space. Okay. A little one, but I'll grade that a 2. Oh. And then we've got like a 3 on that one. Next, we're going to be testing your upper strength. If you can push against me. Shoulder wise. Okay. And if you could lift up for me and push down and pull against me and push and pedal to the metal and toes to your nose. Okay. I think that is just about it. Oh, last thing, if you could, for your fine motor, touch all your fingers to your thumb and finger to your nose. All right, and at this time, since we are all finished, if I had lifted the bed to 45 degrees, I would put the bed back down, and then I would ask the patient if there was anything I could do for him to maximize his comfort. All right. Well, thank you, and you're healthy.